Parkinson's is a chronic neurological condition, and it's one of the second most common conditions in Ireland for neurodegenerative diseases. There's over 12,000 patients in Ireland. However, there's actually a limited number of Parkinson's nurses that help these patients get through the progression of the disease. My main role would be managing patients as an outpatient and inpatient service. When patients come to clinic and they get diagnosed with Parkinson's disease, it's a huge impact in their life, it's a huge thing that they take on. I would be the next port of call for them to get in contact with so that they can discuss and ask questions, and I will provide education for these patients and their families, reassure them.
When I was 44, I was diagnosed with Parkinson's disease, or as it was communicated to me, young onset Parkinson's disease. The great thing about being diagnosed with young onset Parkinson's disease is that you're young. I was officially young at the time. I'm not much older now, but 10 years later. But in that time, I've gone through a lot of changes. I've gone through certainly a lot of emotions. I'm at the point now where I'm dealing with Parkinson's, but it wasn't always like that. Certainly for the first 5 years, I couldn't get my head around it. I couldn't understand how, at 44 years of age, I had got what I thought was an old man's disease.
As an outpatient service also, if patients come to clinic, I'm that person that they will contact in between appointments, so that if they have any concerns, whether it's to do with medications, if it's a deterioration in their condition, I will be the person that they'll contact. This service actually provides a huge impact for the A&E admission, because patients with Parkinson's, they can actually deteriorate quite quickly. If there was more Parkinson's nurses in the country, then patients' support and advice would be a huge benefit for these patients. The families and the patient themselves are so worried about the deterioration in the condition, and if there's not a Parkinson's nurse, they're very alone. My priority is trying to encourage patients to take the initiative to manage their own Parkinson's. And the way to do that is educating the patient on Parkinson's, on the symptoms and how to manage the symptoms.
So many people would benefit from it. For me, it's a no-brainer that we do this. And as long as I can keep going, I'll keep pushing and keep saying this until I lose the ability to speak, because it's really important, and I'm that convinced by it.